Welcome to Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at Neck of the Woods Brewing Company with my good friend Dr. Frey and a return guest, Dr. JoAnne Bullard. Welcome back, and welcome both of you back because it's been so long since we've been on the show. So
Big hiatus.
a little hiatus. We've only been off for about a month, but
Yeah.
we haven't had you on, JoAnne, in like almost 2 years now.
Yeah.
Which is
No.
June of 24 is when she was on last.
Seriously?
Which is crazy to think about. In our we're on episode, this is 145. She was on 105.
Wow.
So
Yeah.
crazy how just time literally just flies.
Well, thank you for coming back.
Yes.
Yeah, thank you for having me.
For sure.
And
For sure.
this was a show we put together over the last probably like month and a half or so, just scheduling everything, getting it all worked up, which kind of set us up to have so many different things to talk about.
Right.
And as before, this episode would be kind of focused on some mental health aspects of athletics and sport.
Sure.
But with that, just all the stuff recently within like the last, 6 months or so, there's been so many things to bring up, discuss, or whatnot. And I think the most recent one to kind of piggyback off our last few episodes would be, the Olympics.
Yeah.
We got a lot of good content out of that. And the bigger one, if not the biggest, was the Lindsey Vonn injury and incident.
Yeah.
We talked about it from orthopedic standpoint.
Yeah.
But
From the actual injury itself.
the Olympics
kind of
are way over. They're
Yeah.
done. The medal count's done. But Lindsey Vonn is very much still in it, going through her long road of recovery. With that, it's just a springboard of
Yeah.
there's so much mental aspect of that too, and that's why we bring you on because
Right.
you're the expert.
And there's been a lot, right? There's a whole bunch of different things we can talk about.
Yeah.
And I think the some of the obvious stuff is go right to NCAA tournament.
Yeah.
But I'm thinking about a different one than you're thinking about.
Yeah.
I think, yeah. So for the much lesser known NCAA tournament would be the for wrestling for nationals this year, and I know that most of the world does not care or pay attention, but it was an extraordinary finals. So first there's nobody has won as a freshman, true freshman, gone undefeated on the season, and won a national title since 1947.
Wow.
This year in the finals, 2 people did it.
Wow.
Whoa.
It's nuts, right?
Next level.
One of the dudes is a guy from Oak State, Sergio Vargas and Vega. I hate to say I forget, but kind of this gangly looking guy, doesn't look like much of a wrestler, and he's just tough, man, and he's just super flexible and just really tough. Just the way he wrestles is a little bit funky, a little bit awkward, and it's just really impressive. And then this other dude, and you may have heard of him. It's possible. I think he has a bigger name. There's a guy who's a freshman. He also is at Oak State, and he started this year, September. He was a high school senior in Pennsylvania, in Johnstown, Pennsylvania, and graduated early. So he graduated this December, went and joined the team in December, and also goes out undefeated on the year, wins a national title. And he was unbelievable. The guy Jax Forrest, and four freshmen total win national titles this year.
That's crazy.
And one of them was a dude, and it's worth a watch. A guy, Aiden Valencia, and a guy from Stanford, a freshman, and he beat a stud from Penn State, Shane Van Ness. And it was really, really exciting to watch. It's actually, I almost want to do a separate show on him in that. So he goes out and he wins, and it turns out his sister also wrestled, and this was the first year they had a nationals for women. And so his sister, I think, placed 5th, but she tore her ACL for the 3rd time in 3 years.
Oh my gosh.
I know. And so I guess this is it. They as a family decided, and she decided I'm done. I can't do this again, which sort of leads us into some of our conversation, which is about to come up. But so when he winds up winning this match, he's losing his mind. He's incredibly emotional, and his sister's there, and they're hugging. It's incredible. It is a very, very touching scene. There's a guy trying to do the interview, and he just backs off.
You got to give him the moment, right?
Get out of the way. Let this happen. Yeah, and it's pretty cool. It's really, really, really cool thing to see.
That's awesome.
But anyway, yeah. So now I guess let's move on to some of the other good stuff we wanted to talk about today.
Yeah. So I guess we mentioned. Well, I mean, we can kind of go off script for just a second, but I think that's crazy of what you were talking about with the these freshmen going. I just feel like as an athlete, right, that pressure of perfection is probably something that's really crazy to deal with in general, let alone being a freshman. first time in this scenario,
Right.
in this situation on a national level, if you will, and then completing it, and then like just I don't know. What are your thoughts?
Sometimes I feel like there's, and I'm not the one that was supposed to answer that, but sometimes I feel like there's a little bit of oblivion, and it's almost helpful. Like they're just totally oblivious.
Right.
But yeah, sorry, please do.
No, yeah, I think that's the correct response. And also, like when they're going in not knowing what they're up against, and then they do well, now they've put expectation on it for next year. So that's where the perfectionistic qualities and traits can really come into play next time around. Like how are they going to respond next year?
Yeah, because I feel like that first loss, whenever it happens, is probably going to be quasi-devastating in a sense of like, or in a sense like the monkey's off your back, like, all right, got it out of the way, now I'm good to just like figure it out and we can go for it.
Right.
That's where like, you know, all those perfect seasons just don't happen. It's just such a rare thing because literally no one's perfect, obviously, right? Like it just doesn't, not human nature. But to go down the discussion again of Lindsey Vonn, you know, she was a little bit public about her mental health battles with this injury. I think, you know, after the injury too, on top of all of it, right, she just severely fractured her leg, had a bunch of surgeries ahead of her, and I think the day after her dog passed away on top of it all.
I didn't know that.
Yeah.
Oh,
while
man.
she was away.
Seriously?
Yeah, while she was away. So, like, I think, you know, you have your support animal that you think you may be going home to who's not going to be there. I think she has other animals too, but still, just like
they do so much.
The weight of all those things
seriously.
coming down at once.
Yeah.
What's your take on her situation story? Or
yeah, I mean, whenever an athlete is injured, there's no clear blueprint for how they're going to handle it. Some athletes can be very poised when they go through it and they just kind of take it by stride and it maybe isn't showing that it's affecting them. And others, it's a lot happening, right? It's an emotional roller coaster. Some days are good, some days are challenging. But when you have kind of like she had hit after hit after hit, and it's in the public eye too, it's sort of, you know, you wonder, how's she really doing? So she's showing things on the surface that we see, but what's going on underneath the surface? Like what's that invisible load that she's carrying or managing right now?
Yeah. And I think I could only imagine it's a decent amount. Like there's a lot going on, you know. And again, I don't know if, again, you can't predict or, you know, change the history or whatnot, but had this situation been a little different, if she hadn't been injured prior to this injury, a secondary injury, and there was so much public attention on her, oh my God, she's competing with a torn ACL. And like we kind of talked previously, like pre-show of like, there's people like, oh my God, she's doing so many cool things. Like this is such a strong moment for her as an athlete. Yeah. And then there's some people like, I think she's setting a bad example. Like people should not be doing this kind of activity with a torn ACL. It doesn't end well.
Reckless,
you know, like so you kind of get like this battle of just all these opinions. And I think the era of social media certainly doesn't help, which is something we can dive into as well.
It was such a lightning rod topic. And then to have the injury, like I have to imagine, it only puts extra like pressure on her within recovery and like dealing with it, and and being just in the public spotlight, like you said, like everybody in the world saw that. Everybody was
in the world
watching.
Saw it, and everyone in the world had some kind of opinion on it at some point in time.
And then there were some broadcasters and people, I think like Adam Grant was one of them that was like, did you compete today? You didn't. Go back to your sofa, relax.
Right.
It's her life, it's her journey. You know, I mean, just to kind of check everyone because. No, that's, Yeah. It
is very, very, very hard. I have to imagine in that particular position. You know, and we did a show on it and that took maybe the less popular view in that like, hey, I give her tons of credit for the guts of doing what she was doing, but I was not more concerned about the way I thought that she handled it afterwards, to kind of brush it off and say the ACL had nothing to do with it. Who knows? Maybe it didn't. But in my mind, in watching it happen and see it unfold, and my concerns going into it, I felt like it probably did contribute to the crash, but she's been like very, very vocal about the fact that she doesn't think it contributed anything and it was just bad luck, and that's just what happens, and the risks that, you know, people take when they ski, especially on that level and at that speed. Do you think that do you think there's a possibility that that some of that stance, some of that approach to say, kind of take that sort of defensive posture, could there be coping? Could that be part of a coping mechanism for this injury? Like, it was a devastating injury and like really really hard on her, and like almost lose a leg kind of an injury. Do you think there's that could be the case that it's just the best way for her to deal with it?
It could be. I mean, she made her decision. She's
Right.
combating people she doesn't even know.
Right,
on
right,
social
which is
media
unfair, right?
that have an
yeah,
opinion.
yeah.
And this could be how she's defending what she chose to do. 'Cause
Right.
at the end of the day, I mean, it is her journey. It is her
100%.
her decision on what she wanted to do. Some of us might not have done the same thing,
Right.
Right.
but that's what her choice was. And sure, she could be saying that the ACL had nothing to do with that secondary injury that she went through, but it's kind of like the unknown. We don't know.
There's no way, yeah.
Yeah.
Yeah, and I think it's also hard too, right? In like her sport specifically, you're going down a mountain at like almost 80 miles an hour.
Right.
Yeah, I think the margin of error is so small, and a couple of inches of hitting one of those poles versus
Right.
not is literally catastrophic, right? Like,
Right. As we saw, unfortunately. Right.
like as we saw, and prior to that, she did a training run. She didn't have any flagpoles. She went up and down the mountain.
Did great.
Yeah, did fine. Looked functional and mechanically stable, if you will. But then that small little blip of an accident, and that's what they're called, accidents. And no one plans to be injured, and I don't think it was in her to-do list for sure by any means.
I still can't believe like the level of guts, fearlessness. Like what? How? It's almost like watching the I forget the guy's name who does the free solo climbs. Climb the skyscraper and type. Like there's a screw loose there. Like there's something different about people like that. She can stand there and like all right, I know this could be my life, but I'm going for it anyway. And it really truly like unbelievable.
And I guess that's the way she perceives the situation.
Yeah.
Like her perception, the resiliency that she has. Sure, she's an Olympian. She's
right,
a professional athlete. That could be different than other levels of athletes, but she has a determination.
Right.
She wants to achieve things. And
Fearless though, like
fearless.
Truly fearless. Yeah. I mean, amazing.
And I mean, I think that's having that ability to be in that fearless state or like that flow state of being so hyper focused on what you're doing, and not letting the outside noise kind of take it away from you, and you just go for it.
Right.
And yeah, unfortunately in her case it didn't go how anyone saw it kind of unfolding, or
Right.
how she planned.
Wasn't in her mind's eye kind
Right.
of thing. Yeah.
Yeah, I don't think she, and I think there was a lot of publicly recorded, or at least showed on TV, like the skiers particularly doing like some visualization. They just closed their eyes and they just were doing this thing where they were like, it looked like they were just kind of dancing, but like they all kind of did it, and it was just their way of visualizing going down the mountain. And I can almost guarantee you that crash was not in her visualization practice,
No.
But to go with that and kind of to spin a little bit on the Olympic side of that is the quad god, if you will, Ilia Malinin, or however you say
Malinin.
it. Yeah. After his upsetting final,
Right.
he kind of came out publicly and kind of talked about his mental health and how he was struggling a little bit. And then again, I don't think he was able to achieve that flow state that we've seen him all in before.
That dude was amazing.
Amazing, right? Like he was doing things that people never did before.
Yeah.
And then
And it was like, it looked easy.
yeah,
it was
it
really
made it
incredible.
look effortless,
right?
which is crazy to think that these athletes are such a high level and they can make these things look effortless. But then he comes out afterwards and just said he basically had a panic attack prior to the final. So what are your thoughts on that, and like kind of how it can, obviously on paper we see how it affected him, right? Like,
Sure.
But what's your experience in that, and like how athletes kind of face that kind of more regular than I think most people appreciate?
Yeah. With panic attacks or just that like extreme level of performance anxiety, an athlete is taking in so much stimuli from internal factors, external factors, and it all weighs on them. So when they do get to that point of, I know he viewed it as a panic attack, or he spoke about it as a panic attack, physiologically what that does to your body, right? That intense rush, but then you usually calm down after 10 minutes or so. But performance anxiety or anxiety at that level can last for a while. So he could have been carrying different levels of performance anxiety, the high pressure situation, the Olympics,
Right.
all eyes on him, and just not really knowing how to navigate it, especially if he didn't have coping skills in place beforehand. I don't know if he worked with someone in the mental performance space or not. But, helping him stay grounded or helping him connect into just what's happening that he can control and not worrying about factors outside of his control too.
Yeah.
But being at that heightened state when you're in a panic mode, you're not really able to process the thoughts, right? You're not able to concentrate or focus on the task at hand.
Yeah.
I didn't hear it, but I had heard that after the kind of meltdown performance where he struggled, and like amazingly he was able to pull the same thing off, when during the team scoring thing and like.
Right.
But I had heard that one of the things he said as he basically was skating off of the ice was basically along the lines of like, that's why they should have brought me 4 years ago, like so I had this experience so I wouldn't feel this. So do you think there is? Well, so it's, I guess 2 questions that come from that. One, do you think there's some validity to that statement? I mean, I have no idea how good he was 4 years ago.
Yeah.
He's pretty stinking young, pretty amazing now, but pretty young. And then number 2, let's say he's still in it and comes back in 4 years from now. Does this now add pressure to that Olympics now that he's had the hard time on this one?
Sure. So I think going to your first question, if he came 4 years prior and went to the Olympics first, I mean, that's getting an experience. Kind of like we were talking about with the wrestler, like going in kind of blind, like, ooh, I don't know what and then doing awesome. Right. When you have that first experience, then you can kind of reflect afterwards what went well, what didn't go well, what do I need to strategize better for. So could it have helped in preparation and managing performance anxiety or just the challenges of being an Olympic athlete, like at that high level? Right. Possibly, right? Like that could have been helpful. Preparing for the next 4 years, same type of philosophy. I think once an expectation is placed, then, I mean, when athletes have that view of what they expect of themselves, or even the pressures of what other people expect of themselves, then they feel like they have to hold it, right? They have to hold that level. And that can put on a lot of additional layers of pressure even before they get to the Olympics in 4 years. So learning how to navigate that space is important, to let them know that, like, evaluate, maybe taking some time to figure out why this panic attack really occurred. Right. And then how can he prepare better the next time around? So
it doesn't happen again.
Yeah.
And like he's won world championships already, as far as I know. But I mean, I guess it's a different stage, right? And
I think it's also interesting in that he's only 21 years old. I just looked it up, and so 4 years ago he would have been 17. Which I don't know. What are your? I don't feel like a 17-year-old would be mature enough to maybe handle that situation potentially again. Like, I don't know him personally at all, but it could have been something where, he says he should have been there 4 years ago, but could he have handled it differently, or would it have been a worse experience and maybe piled on to make this one just as bad, or
I think it's a lot of unknowns.
Oh, 100%.
Yeah, for sure.
All speculation at this rate. Yeah.
So, and it is very interesting, and we have kind of like a little bit of like a pre-write up some of the things we may want to talk about. So I'm going off topic a little bit here, but in the same sport, completely contrasting approach would be Alyssa Liu, right? Like, and she left the sport. She didn't like the pressure of the sport, the pressure her father was putting on, all this other, and then she came back because she loved the figure skating, and she did it kind of on her own terms. And it almost seems like that's what won it for her, that she was able to skate like more freely than everybody. I don't know. What are your thoughts on that? Yeah,
change of environment, change of pace. Caitlin Ohashi did that also.
Right.
Being at like that Olympic level or national level and then taking a break from it.
Yeah.
Finding her love and passion. She actually got injured, and I think something with her spine or something like that. And she said in one of the Players Tribune articles, like, she was happy to get injured. It was her out.
Right.
Yeah.
And then she took some time and got back into the gymnastics world, but I think at UCLA, and she had a blast.
Right.
Right. So when you have that ability to make those decisions and reconnect with your passion, reconnect with your why, I think that's pretty awesome. Like, to be able to have that much autonomy in that space.
Yeah. And it was very interesting to hear her interview, the Alyssa Liu push, like be like, I'm just here because I love it. I'm just going to enjoy the experience, like to a whole nother level that I don't think we're used to hearing from athletes. Like, whatever happens. I'm just going to do the best I can, and it's okay. Yeah.
I think that's a similar take to the 40-some-year-old snowboarder, American guy, who's like, I've never had more fun losing in my life. This is the best time ever.
I remember that too.
And he
Yeah,
was
yeah.
just having a good old time. And
Yeah.
I think, that guy, if he won, he would have been ecstatic.
Yeah.
If he lost, he was still happy. But
Yeah.
again, he was just in that happy state. It was like he was just happy to be there, appreciative of the experience, and just had a good time.
And if
Yeah.
I remember correctly, in the last Olympics, he was like fourth or something. Like he just
Yeah.
missed the podium, and there was a lot of like sulking and not like feeling the moment or enjoying the moment. And maybe that's what he took away from his previous Olympics, right?
Yeah.
Like you know what? I regret not enjoying it. Like I did great. Granted, I wasn't on the podium. Like and this time around, regardless, no matter what happens, I'm just going to enjoy the moment.
And I think that's the uniqueness of the Olympics, right? It's every 4 years, you only have literally one shot. You can win your world championships in between, and that is great, and you do get to become a decorated athlete in that sense. But like to peak at the right time in that every 4 year increment to like someone like a Simone Biles or someone who's
Right.
who's
Who
done it
also
so-
had her own struggles, right?
right. Again, like we keep like circling to, you can name almost a lot of the Olympians who've had, openly discussed their mental health stuff, especially in today's world of athletics. It's much more of an more open topic. It's more talked about and discussed, which is, I think, is a good thing overall.
Yeah.
Yeah.
I mean, they're using their platforms in a great way
Yeah.
to be able to create normalcy with it.
Yeah. Yeah, because I think the narrative used to be driven by articles and other people, interviews and short blips. Now, we say, 20 years ago, a Lindsey Vonn situation happened. That story would have been able to be told from her point of view at this rate. Like I follow on Instagram, I see her rehabbing every day and all the things she's doing and all the, positive, uplifting things she's saying or what she's going through. Whereas before, you could just read the newspaper, if you will, if it was going that old, and just like, oh, this is our side of the story, and it's not that good, or it's really great, or whatever the case is. I think that's kind of wraps up our Olympics discussion
Scenario,
if you will. We kind of put a bunch of different things on this, and then the last time you were on, we talked about a professional golfer who committed suicide, which was a relatively pretty heavy topic, and we've unfortunately seen more cases of suicide across the world in sports, but at least recently in the NFL there was 2 cases of Rondell Moore, but just last month in February 2026, and then during the season, Marshawn Nealon of the Dallas Cowboys back in November also committed suicide, and it was just one of those things of, yes, we talked about it the last time, but it's just one of those topics that unfortunately is a current thing in the world as it is. It's always kind of been, but I feel like it's more publicly available, this information now. So what are your takes on the recent stories, I guess, in the NFL, and we can kind of dive into some other things for their particular cases?
Yeah, I mean, I don't think it will ever be something that's normal
Right.
to see a story come out with somebody that died by suicide. And I think it creates also that sense of humanity, like they're a person.
Right.
Like we're people, they're people that are going through things. We're going through things.
Yeah.
And sometimes we put professional athletes at a higher level because their lives are so public, and they might have had the same struggles we're having, you know? And so, I mean, I think it's always challenging, but it is more, everything's at our fingertips now.
Yeah.
So we are hearing about things
Yeah, and I think
faster.
I don't know much about like going up into the Rondell Moore case, if there was any like backstory, but Marshawn Nealon, at least you would think publicly everything looks okay. He just scored a touchdown on primetime TV. He scored recovered a fumble, scored a touchdown. And I think within a couple weeks after that, he passed away. Like, how quickly things change, or like you said, they're normal people. They got other things going on, and you see them for 60 minutes on Sunday or whenever the game is, and then real life happens outside of that. And it can be really hard and really crazy, in that you don't see that struggle.
Yeah, I feel like we see it, we hear it more and more frequently from athletes, and they're not wrong. I think their points are good. Where the public in so many ways thinks of them really just like their point generator for their fantasy team. You know what I mean? Like they're not like considered like even like real people with real emotions, and I think a lot of the world does recognize it and see it that way, but then there's a lot of we're in the Philadelphia area. Philly's pretty tough on its athletes, right?
Very.
Like, and it's almost like people ignore that fact that these are real people. They're not just a video game or character or whatnot. And it is interesting to see people speaking out, like back off, like what are you doing? Like, we're doing the best we can. We're people. I don't know. I find it very interesting, and every time something like this does unfold, it's a reminder, and I think there's a sort of this perception, like what do they have to worry about? They're on top of the world. They make tons of money. They don't have a single problem. But it's not really how that necessarily works. In that moment, when you start to unpack it, you're like, why? Like, how? Why? But I think that's the issue. There's no real good reason. And that's where, I guess the mental health portion of the equation fits in. No, they're just that's exactly the problem.
I think it's also connected. We spoke about a little bit with Lindsey Vonn, but that iceberg philosophy, right? Like what you see on the surface,
right?
As people who are watching that game or whatever, or what they might be posting on social media, or how people are talking about them, like they have it all, or they have the life that, like, oh, I want that, or whatever it might be. But the big part of the iceberg underneath the water, that's where it's like you never know what somebody is, and athletes or people in general can always put on a happy face. Like they give you the students that are showing up to all the classes, the ones that are adhering to the rehab program, the ones everything's good, but really they could be silently struggling.
Right.
Yeah.
And I think to kind of bring up a point that you mentioned too is like the world of social media now, right? Like people are on it all the time.
Yeah.
And everybody can be a keyboard warrior and have all the things to say in the world. Like I'm sure somebody who is very unathletic, never take any risks in their life, was bashing Lindsey Vonn in the comment section of like, you're silly for doing this, blah, 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 or whatever the case is. So what are your takes on just the broad topic of social media and the negative aspects of it that it brings to the world of athletics and athletes' mental health?
It's definitely an advantage. I think there's tons of positives with social media, but there's also just as many negatives with social media too. I think I don't know, we're all adults here. I find sometimes I get stressed out with running like my business page on social media or things I see that are disturbing, or I start mindlessly scrolling for hours, when I should be doing something else. But if you think about even just younger athletes, how can they mentally handle that? Like that's communication now. Right. Like that's how they are communicating with their friends. That's how they are getting their news. They don't have the newspaper really. Like,
it is unbelievable. Yeah.
That's how they're getting their info. And it's hard to navigate that.
Yeah. I almost think it's like it's to a point where it's just too much for the human brain to kind of it's like system overload. And that's why, when you take a break from the screens, and like you've mentioned before, we talked about when you go hiking in the woods
I love it.
And you come back and you're like, oh man, that's great. This past weekend I went to a float spot and did a sensory deprivation tank and floated for 90 minutes. And man, it's so good just to shut off from the world and just literally be completely deprived of all senses, and you're just literally floating. But I think in general, right, like these younger kids and younger generation, that's all they know. It's just this phone and this little box with all the information in the world, and you have everything in your fingertips. Yeah. And it's just it's just too much, and it kind of spirals everything out of control.
And here's the old guy cynic sort of version of this or take on it. But a lot of what's done is driven by money, right? Like people are like, I can make a living doing this, right? And they do extraordinary livings, and people see that and that's easy to do. What a great way to make millions of dollars. I want to do the same thing, and come to the conclusion that the only way they can get attention is clickbait. So the information that might not that they're presenting may not necessarily be true, founded in fact, maybe an opinion. It might be some crazy dude. Who knows? None of it's vetted. None of it's really truly there is good information out there. Don't get me wrong, but it's really hard to sift through what's good and what's not good. And AI changes that whole game because all of a sudden now it looks real, it seems real. Not necessarily so right. It is very, very interesting. It puts a whole different dynamic, and for people who have kind of lived through a previous world before all of this and then the world after, I think you view things differently. But like you said, like this is their only form of communication. Whatever is online, is on TikTok, is on, like that's reality for them. Like that's what's out there, and that's what everyone sees and everyone believes and everyone perceives, true or not. And it does make it tougher, but that's not to, like, there are dramatic advantages, right? Like you have certain exposure, you can learn certain, but it comes at a cost as well.
Yeah, for sure.
And I think it's probably pretty well tied into mental health, unfortunately. That's one of the big issues that's associated with it. And this may sound, and I don't know, you can comment on, and I think it actually this carries us to sort of the next topic, but I feel like those people that are struggling in silence are more likely to be the people that may not have the ideal result or the ideal outcome. They're doing it, they're trying to, buck up and, put on a smile and present this front, and sometimes a false front. But I think that struggling in silence tends to make things worse in the end. And maybe it's because they are afraid of social media, or maybe it's because they're afraid of this. And so this brings us to the UCLA basketball player who put out the article, and I'm not sure what to call it, Lauren Betts.
Yeah.
And I feel like, first, people using their soapbox, using their pedestal to get a message out there is wonderful. But then too, I feel like those are the people that wind up coping, handling it best, and whatnot. I don't know. Yeah. Do you want to go into a little bit of what?
So I think this is one of those cases where, like you were mentioning, like, yes, social media, like we mentioned, could have a lot of negative aspects, but you can also find a lot of support in the world of social media.
For sure.
And your story, or your presented story, could also affect someone else who's reading it and give them the courage to maybe step out,
keep going,
find
help, whatever it is.
So Lauren Betts, senior center from the UCLA women's basketball team, just put out an article in the Players Tribune, or I guess it's an essay, article, whatever.
Right. It's essay, I think maybe is a better way.
Yeah. And the title was "I Want to Be Here," and it was released on the 19th of March. And for the most part, it kind of just went through her story of depression during her freshman year at Stanford. During her freshman year at Stanford, then she transferred to UCLA. There's a lot of hype around her because she's a big, tall guard in women's basketball. And then, all the hype of her on-court stuff, then she just kind of felt like this feeling of sinking and drowning while making, everyone thought she was this invincible basketball player, but like in the inside, she wasn't doing so well. And then early on in this story is from 2024, she experienced a crisis, and, she was in her article, she put a dangerous headspace. So she checked herself into a neuropsychiatric hospital, and she spent 48 hours on a gurney in a hallway in a psych ward. And like, that kind of was her message, or her way of, figuring it out. And her, then she spent 2 weeks away from the team, came back, and then they made a historic run. They went to the Big Ten championship and a Final Four appearance in women's basketball. But that was 2 years ago, and the story just came out now, and it's like, that's a lot to unpack, and I'm sure it took a lot of time to write that.
Right.
That entire,
guts.
And exactly, and a lot of courage. So I sent it to both of you I didn't read the whole thing because it was a lot of reading. And I was.
And we do have lives, work, and everything.
And I was doing, and I'll admittedly say I kind of was scrolling through it at work, and I was like, I can't read this whole thing right now, but I kind of got the idea of what was going on. And I kind of looked up some summaries of it just to kind of make a quick note for this. So what are your thoughts on this story, if you will, the essay, and kind of how this all kind of came out?
I did read the whole article.
Okay.
I'd like to let you know.
Yeah.
No, just kidding. But if you, in the article, she talks about like the beautiful life that she has.
Right.
Like her family, how supportive they were. Her mom was always like throwing parties, like, hey, it's someone's birthday, let's have them over. Like, it was just it sounds like a very supportive upbringing and exposure and all of that. But it's hard to see when that shift happened. I mean, she might not know when that shift actually happened, but she said she was something to the effect of like, she was afraid. She was like, one day it was like, I need to talk to somebody, or I don't think this is going to go well.
Right.
And that's when I believe it was her athletic trainer she connected with.
Yeah.
And that athletic trainer got her to the hospital to get the help that she needed.
Yeah.
But that, to me, speaks to like being in such a vulnerable state, to know that there's people that are still there to support you,
Right.
and that you can trust,
Right.
to be like, I need help, and they're not going to question you. And in there, she also said something about like, the only person she usually would speak to about things would be her mom.
Right.
Like, that would be her soundboard. That's the person that she knows wouldn't judge her. So for her to be able to know, like, I need something past my mom right now to get the help I need. I think that's a warrior mindset. Like, I think that's awesome that she was able to get the help that she needed.
I sort of, she's like, I think she's 6'7", right? Like she's tall, right? Like, and I think she had said when she lived in Europe that like, people didn't seem to give her as much grief, but for whatever reason, when she got to the U.S., she caught a lot more criticism, a lot more grief, and she sort of began slowly sliding into this mindset. And I think we did talk about it at one point on a previous episode, and I don't remember if it was the episode that you had previously joined us on, but like that athletic trainers do have like that sort of close connection, right? That close contact, where like me as an orthopedic surgeon, like I see them once every month, I see them once every 6 weeks, you know, whatever it is. Like you're there with people every day, right? Like, and it is like, you know, we talked about how important it is for the athlete to know that their best interest is what you have in mind, right? Like that's what you like, and it's part of what helps sort of build that bond and build that relationship. And like, what an impactful way! Like, what an important thing to hear her like reach out. Like, until that point, she'd only speak to her mom about whatever thing it was, and like to be able to speak to someone who's like recognize it, accept it, and try to help her. You know?
Yeah, and I think that's one of the things I always bring up when people talk about athletic training and this uniqueness. Is like, I see my patients sometimes roughly every single day, and it's like it can be a lot sometimes because you're just, but at the same time you get to make that personal connection, and then you can just tell, like, if you see someone every single day and they come in and they're like, you know, they're always joking around or they're always happy or they're always running around singing or doing whatever, and you feel their presence in the room and their presence feels off, and you approach them sometimes, and then you do, you know, just by saying, hey, what's going on, you open a can of worms. You're like, holy cow, this is way more than like a basic ankle sprain, if you will, or whatever the case is. And it's just like, there's way more to them, like we've mentioned. And that's what the beauty of my profession is. Like, I get to see the good, the bad, the ugly. I get to see them when, you know, they call me because they're doing, you know, they're not doing so good. They call me when they've been throwing up all night and they're sick and they can't make practice. They call me because their foot swelled up so much they got scared, they didn't know what to do. Or like whatever those small things were. And I noticed that too, of like in that article, you know, I think in the beginning, from what I was reading, she was just like she kept saying, I don't want to do this anymore. I don't want to be here. And she couldn't stop that narrative in her head.
Right.
And so, like you said, she didn't know who to call. So she said, I called my trainer and they came, picked me up and took me where I had to go.
Right.
And it's like, I've had those situations where athletes are in crisis and they start opening up and you're like, all right, well, and then I'm totally all right with calling and referring and trying to figure it out to make sure that they're okay. But like, I'll never assume the role of like, I know exactly how to handle that situation well. Like, but I appreciate the comfort level that you have and I feel like there's like I don't know, you could agree with the two of like, there's like a barrier in the threshold, and once you break it and you kind of get into it, you're like, all right, now we're going for this and we're going to make sure we're taken care of. It's not like you flirt with the idea of you're talking, I've been in those situations too, like you could tell the athlete or patient who's like, I kind of want to open up. It's like, I'm still reserved and save it for another day. Or you hit that and then you don't dig, but you just talk, and the next thing you know, the floodgates open. You're like, holy cow, you had a lot going on there. Let's figure this out and get you to the right people. And in my world, I refer them to you, literally. So it's nice to, you know.
I get the emails.
And that's great. You know, and I think that literally happened this past like couple years. If I had an athlete who was just kind of standing in the hallway and I'm like, hey, what's going on? You're like, definitely something's going on. Like I saw you at practice, your performance was off. And then again, I didn't push, I just talked. And the next thing you know, it opened. And I'm like, I have a person for you. Let me send this email. Let's see if we can figure this out. And then like, and that's where at least I appreciate how we work together in that regard of like, you're just an email away. God forbid, and I need something, you know, more than that. Then we figure it out. And it's just one of those weird, you know, things that athletic training has. You just see people every single day, and when one little thing's off, you can catch something, and you can save catastrophe, really.
Yeah.
Yeah. I think it's that, that vulnerability spot. You know, if somebody, when you're at this point where you feel you're at your lowest, you're raw, you're kind of exposed, and you're not just going to probably speak to anybody, you know, and just be like, hey, this is what I'm going through. But if you have that connection with someone you trust, you may not even know that the athlete trusts you or likes you.
Yeah,
Right.
100%.
You know, and then they're like, hey, Brandon, like, I need help, or I don't know what to do. And that could have been the hardest conversation that athlete has been preparing for.
Right.
And they finally like advocate for themselves.
Yeah.
And it's like
Yeah.
awesome, like for them to share that.
So on the flip side, as the person receiving that conversation, take that one seriously.
Yeah.
You know, yeah. And I also found it interesting in her essay that, you know, when she was talking about it, some of the things that like she was like, when I was admitted, right? Like I was thinking about like, what's going on with the team? They really need me, or they're losing, and all this other stuff. And like in our mind, these are the biggest things in the world. But in reality, like at that point, like it's secondary. Like, and then I think it puts it in perspective. Like then when that person does come back and see, and that person then is welcomed by their team and not shunned by their team. You know, like it does sort of change everything, their outlook, and yeah.
Yeah, I think it changes the lens a little bit. I mean, like when they're in that not so good spot, you know, things are probably just kind of in a darker filter in the world, and then you come back and you see how happy people are just to see you, and that you're okay, and that you're like, that you're not making the big play and you're winning the game, that you're just breathing and happy, and you got a smile on your face. You know, that's there's so much more to life than sports, and I think, like we mentioned, like people get distracted by that because they need XYZ athlete to give them certain many points in their fantasy football team, or they need their team to win, and especially now in this world of betting everywhere, they need that person to do this so they win a bet, or whatever the case is. It's like, well, again, like we mentioned before, they're just people at the end of the day, and they have their struggles, they have their ups and their downs, and sometimes they get really down, and we have to pick them up somehow.
I think some people also are better at using some of that. Like it depends on the individual personality. Some people use that pressure to drive emotion, to drive like the clip of the Maryland coach, like, and some people respond differently to that pressure. It is not ideal for a lot of people. Do you want to talk a little bit about that clip?
The clip that you were mentioning was the Maryland women basketball coach. And on surface level, when I first saw the video, I saw the video with no sound, and I didn't hear any like commentary. I just saw it, and it just, the coach was just like in the I don't know how to say her name, Aluchi Okinawa. She was in her face just yelling. It just looked like she was yelling.
Yeah.
But then I watched it a second time, and I read the caption of like, she was more or less saying that she believed in her player, and that she needed the best out of her in the situation.
Right.
And then later on, you know, again, social media, everyone has their opinions. They're like, oh my God, she's bashing her athletes. She's so aggressive. Then the athlete came out and said, no, I appreciate hard coaching, and that's how I get motivated, and that's how I do well.
Right.
And again, I don't know the women's coach at Maryland at all. I don't know how she coaches everybody.
Right.
I hope that she coaches her athletes how they perform their best, and this one particularly, rises to the occasion when that kind of coaching is involved.
Yeah.
So what was your take on that video?
Yeah.
When
at first I was along the same lines as you, and then I was like, whoa. And then I saw another clip where it was somebody like reading lips, and then I was like, oh, she's saying, I believe in you. Like, you can do this. You have to do this. But that all comes down to that like motivational climate that the coach establishes. That's that leadership piece. And not every athlete is going to have the same relationship with their coaches. It's going to look different for each athlete. But if you trust, like this athlete trusted in the coach, that the coach does have her best interest for that athlete to perform, then if that's the style that that athlete responds to, awesome. It might not work for athlete B on the team, but for this athlete, she needed, I guess, a little bit of that tough love style of coaching in order to like turn it around for herself in that moment.
For sure.
Yeah, and I think that's, again, it just kind of encompasses everything we talked about, like the social media piece. Everyone had an opinion on it, but it's like, no, it's tailored to this athlete specifically. And then she defended it and said, no, this is how I get the best out of me. And it worked, right? And I think that they're doing okay. So it's just crazy, again, how the filter of the world of social media and sports and everything you can see you can't just assume what everyone's going through. You can't assume what they're doing or how
Right.
they're responding to these things until you know them on a personal level, and you find out what makes them go and what makes them not go.
Right. Right. I think some of the best coaches are the people who can figure out that about their athletes, right?
Yeah.
Like
that separates them, right?
who responds to this, who responds to that, and can sort of motivate and guide their athletes, as whatever works best for them, kind of a thing. And it's probably something for our athletes to consider if they're considering this school or that school and this coach or that coach. Like find someone that might fit, because some people maybe some of the coaches maybe they've had success, but their secret sauce, their formula for success may not be your secret sauce. It might not be what you respond to, and it's a consideration as you're choosing where to wind up.
I think I show this to my class a lot when we talk about coaches and leadership styles, and I show Bobby Knight.
Of course, yeah.
And then they're like, who is this?
Who? I know. You're like, oh, man.
But when you learn about, he's one of the most winningest coaches in
Yeah.
NCAA history.
And throwing a chair
he knows
across
what he's
the-
doing,
yeah.
right? Throwing metal chairs. But when you read about it,
Yeah.
like half of his athletes are like, I hated playing for him, didn't like him, left the school, and the other half's like, I would play for him again in a heartbeat.
Yeah.
Right? So it doesn't have to do with the uniqueness. But I also think in today's age, first of all, you can't throw metal chairs, but
Right.
Definitely frowned upon.
yeah. But in today's age, I think strong coaches need to be able to ebb and flow with the different generation of athletes.
That's a
coming
huge
up.
part of it. It's a very different generation. It is.
Yeah.
Yeah. What was acceptable, 20, 30 years ago is probably not really acceptable lots of times anymore.
Yeah.
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 Yeah, and I think finding that balance is really important to get the best out of your athletes. But then I think it's also another reason why the world of the transfer portal and the world of college athletics is so volatile, if you will, and people are always transferring out and going other places. And
Yeah.
again, if you don't feel welcomed or comfortable wherever you're at because of Coach XY or whatever the coach is, then yeah, move on, find somebody else, and hopefully you can do well in another institution and figure it out that way.
Yeah. I think one of the big take-home points, and I feel like there's 10 different directions, 10 different things we could have talked about in terms of the psychology of sports and whatnot. But we kind of went down this little bit of a darker road, like that, which was very impactful, right? Like when we're dealing with this and we're talking about these particular topics, I think the right answer is like speak up, right? Like the whole it's okay to not feel okay, like every time, right? Like, and then also on the flip side, when speaking to the healthcare professionals, like take those conversations seriously. Like you can't not, and do what you can to help in that particular situation.
So I think in that regard, what are some resources that you're aware of or that you would recommend to anybody listening to this who might be in? So I think it kind of be twofold, right? Like I think, what are some resources for the athlete as like if they're not feeling well or not doing okay? And then I think what's some resources for the medical professional in taking that information to go outward to find the right avenue for help for their patient.
And I have a follow-up question to that one too.
Okay. So for the athlete, I think it depends what resources are at their fingertips, right? If we're talking about like college athletes, they have a wellness center in place. They have more on campus.
Yeah.
I don't know if they know about it all.
Right.
I think that's another area.
Right.
I know where we work that we do publicize and do show a lot of QR codes and how to get help if you need it, but I don't know if that's everywhere.
Yeah.
But for those athletes that maybe aren't on a college campus, more high school level, or even adult athletes, professional athletes, is to contact the people you trust first. Reach out to a parent, reach out to a friend, reach out to a significant other, a coach, an AT, somebody who provides care to you if it's something that isn't of like immediate need in that moment. There's 988 that you can call, a hotline, if you need immediate attention or help, or 911, if necessary. Those would be more of the extreme, resources to tap into. So that's really knowing your scope of practice and expertise. I don't think there's any mental health professional that does everything, right? So knowing what you can do, who you can help, but also building your network for referrals and having those referrals at your fingertips. So kind of like, how do you triage out? If you're working with an athlete Like, I work only in the mental performance realm. I don't diagnose. So if I'm working with an athlete and they're presenting depression or they're presenting disordered eating, I have my resources available to get them to that next person and start that conversation, which is really important.
Yeah.
But that's where, knowing who your partners are in this space, because I think at the end of the day, you're all there for the same reason to help, right? You're in a helping profession.
So, and this may not be a fair question because there may be more than one answer to it, but what does an athletic trainer or the sort of healthcare professional, how do they navigate a scenario where somebody an athlete confides some of this in them, but kind of says, I don't want you to tell anybody, swear them to kind of secrecy before they unload some of this information on them. Like that is a delicate situation. Any suggestions? And again, it's probably different with every single scenario, but any suggestions on how to navigate that particular scenario?
That's hard.
I know. I'm sorry. I dumped that one on you without any preparation.
That's hard. So let's see. Breaches to confidentiality and privacy. That's where I always go first.
Right.
And when I'm working with an athlete, I would breach confidentiality if they're presenting or talking about harm to self, harm to others, abuse to the elderly, abuse to somebody that's disabled, abuse to a child.
Yeah. So that's when all bets are off.
That's when
just
all bets
have
off.
to.
Or if court ordered, that I have to turn something over.
Yeah.
So those are the only 3 areas that I would breach confidentiality.
Right.
But in your spaces, I don't know what your confidentiality and privacy legalities are.
Yeah. I think we fall under that regard of we're a mandated reporter, and when those like you said, all those things come into play. If there's
legit
harm to
concern,
self, then it's you kind of have to listen if you want to, but if you say something that I'm going to be, my hands are tied and I will report it. It just kind of how it comes out.
Yeah. But it's in their best interest.
Right.
And I'm not doing this to hurt you.
Yeah.
This is really, I'm trying to help.
Yeah, and I think that's
even if they can't see it in the moment.
Correct. And I've had situations where we've kind of not held them down, but held them in our room of you're not going to go anywhere.
Yeah.
I can't let you leave until we get the right people in the room to help you. And I'm not trying to I'm just letting you know that if you say certain things, I have a job to do. And it's very similar in a sense of when you go down the rabbit hole of someone saying that they get hit in the head and they have concussion-like symptoms. If you start telling me you're feeling this certain way, I'm mandated by law that I will take care of you in this, And I'm not, advocating to lie to me, but I'm just saying if you start to go down this way, we will approach it that way, and that's how it's going to be.
I don't want to violate your trust. This is what I need to do.
And then again, you kind of back it with this is for your best interest. You kind of go supportive route and yes, I'm here for you, and we're going to figure this out. But
right.
You try to avoid that if you can. It's hard when I've been kind of in those situations a couple of times where it's well, yes, I can do that to an extent, but if you do cross a line, there is no going back to what I have to do.
Yeah.
So.
You ever watch Family Ties? It's an old. Do you know what I'm talking about? Family Ties. Do you remember?
No.
It's a great show, man. It's from the '80s, but it holds up. It's funny, and we have an LG TV at home, and it has Sam has a Family Ties channel, and it's funny. A lot of the episodes come on, and my daughter will watch, and she's like, "Man, it's good. It really does hold up." So that's sort of one of the episodes where it's very fun. It's Michael J. Fox, and one of the episodes he's doing this. Suicide hotline or whatnot at school, just basically for extra credit, so it looks good on his resume and whatnot. And basically as he's leaving, he's there with another guy that he kind of competes with. They get a call and that's it. It's first aid, and he's not trained to handle it. And it's interesting. Yeah. It's fun, but it holds up over time. It's a great show and it holds up over time. Just being there and talking to him and being available and the whole, the best ability is availability. Just being there makes a big difference. Yeah.
And I think your gut and your instincts also guide you in that space too. Okay, I can't let you leave the room. Yeah. Stay here. We're going to get you help if whatever, or I'm going to drive you to wherever it needs to be. I think that also really guides
and I think a little bit too of I don't know, later as I've gotten, more seasoned in my career, if you will, at the end of the day, whatever's going to help me sleep at night too, I'm not going to let you leave in this disordered state or like, this not so good scenario. Or if I don't feel comfortable with leaving you, like, I'm just not going to do it. It's just not, again, our gut instinct is like, we got in these professions, whatever it is, to help people for whatever reason. There's
That's what drove you there. Yeah.
that inside of us are being that we want to help other people. So like at the end of the day, yeah, you're going to do that. And I think to advocate to any athletic trainers listening or anybody who's working at different schools or whatever, find your people that you work with that you may not know about. Like,
Yeah.
Like you mentioned, we have a QR code wall, if you will, right outside of our door with every single different like resource that we have. And it's really easy to kind of just shuffle an athlete like, hey, top left, yeah, that one, scan that one, and then do what you got to do on your phone, and we'll be okay, or whatever the case is. And I think making those connections and talking to the mental health professionals that you're engaging with on the regular, go to the literally just get up out of your office, walk to the wellness center, and go meet those folks, because those people can probably help somebody that you don't realize is going to come in your door one day and going to really need some help. And to make that phone call and to know those people on some kind of personal level makes the situation way better for everybody.
Those have to be some of the hardest moments, sort of like in your career, and preparedness, just like you're saying, like it's probably coming, and just think about some of those things, meet those people, be ready. Don't. One of the when I was an intern, so general surgery internship, one of the things that the chief of surgery used to say at that point in time. I butted heads with him a little bit, but I will say this was a fairly valid point, and he would say, the airline industry has way fewer issues, incidents, and yes, it's not perfect, nothing's perfect, but the reason they do is they have an incredible checklist, right? The reason they have an incredible checklist is the first person to go down if a plane crashes is the pilot, so he's going to make sure he has that checklist in place. But they fewer issues, fewer crashes, fewer problems. It's a tough time to be talking about this right now.
Yeah.
But it's preparedness. It's all about that. So see the problem that might be walking in the door, the challenge that may be walking in the door 2 weeks from now, a year from now, 2 years from now, and just have those pieces in place beforehand.
I think also talking to the people in your network or your referral system of how do you want me to contact you? There's some people that I know, like between athletic training, myself, and the wellness center, we have a little triangle going, and it's like text messages or whatever. And I know I can text somebody in the wellness center almost at any point in time of the day, like no questions asked, like, hey, so-and-so is coming your way. And I know that person's going to take care of it. But like, how do they want to communicate with you and put that into place?
Yeah, and I think, like I said, just doing a very safe, comfortable dry run of all this open lines of communication makes it way more easier for when, that person sitting in front of you having a crisis, whatever the case is, and who's the right number, or you at least know where to find that number, or whatever it is, and having that plan set. So it's like, again, you're prepared. You're not going into it blind and you don't know. You're not just like, I don't know what to do. It's like, I know. I can call somebody and we'll figure this out together and go from there.
And humanity, right? Just be human.
Yeah.
It's a hard one, and it's easier to say not in that situation, but like understanding, in the situation.
Yeah. So I think that covers all kinds of different things tonight. We went all over the place. We kind of omitted some things on this list, which is totally fine.
That's what happens.
But anything else before we wrap up?
Thank you for having
me. It's
always
so fun and light.
I know. Yes, thanks for coming on again.
Thank you very much.
So much fun. We talked about a lot of different, kind of heavy topics, if you will.
It was some of the most important stuff we talk about.
Yeah, and I think that's what it comes down to, right? Like, you just have to have these open discussions to kind of, for people to understand that people are people and things happen, and finding the right resources is really important to, for the best outcome for another human, right? Just keep another human up, and that's kind of what we've all decided to make our careers out of in a sense.
Right.
So again, Dr. Bullard, thanks so much for coming out.
Thank you for having me.
Hopefully we won't wait 2 years till next time, and
right.
Maybe we will have some other more positive things that we can talk about in another light. But before we go ahead and close out our tab tonight, just a quick shout out to our sponsors, Neck of the Woods Brewing Company, who I forgot to mention on the Open Sour Fest May 16th. For anybody in the local area who wants to try over 40 plus sours and some good vibes here at Neck of the Woods in Pittman. and our guy Kyle over at Timber Reel Productions, hooking us up and getting all this media out to everybody. So thank you again, and we'll see you next time, folks.